Yeah, exactly. So.
Okay, we're going to get started in 2 minutes. We're going to get started in 2 minutes. Thank you.
Exactly. 2 minutes? Are they all going to be back?
I said they can either go back over there or on the other side and not approach anyone.
No. Our folks that are talking, are they going to be lined up behind us?
Oh, well, we don't want to just within 6 feet. So, yeah, it's fine. She wants to stay there.
Okay.
And you just say, now I'm going to turn over to Heather.
Does Heather know she's turning over to Sella?
Let me make sure she does.
Oh, that's timber. You done broke it now. So.
Okay, this is going to be a problem. Whoever I mess up your mic, I'm apologize.
Is there a way can we
That's what I was afraid
turn
would happen
this
to you, but
around
live on
just so
camera.
the leg isn't sticking out? We don't want to really trip another speaker. So if we could maybe post it.
I didn't want to obscure yours.
Right.
Does it? I mean, we got 1 minute, so.
My fear is if you tripped over it, somebody else could trip over it. You know?
Well,
That's a little better. Don't trip.
that's the best I can do right now.
Okay.
Everybody good? All right. Good morning, everybody. John Ward, Director of Emergency Management here in Clay County. Today, we're at the opening of our vaccine point of dispensing here. Very exciting. And first, as always, you guys have always heard me talk about the partnerships. We've got partnerships with the health department, BCC employees, and our sheriff's office has been attached at the hip since the beginning of March when this first started impacting our community. And I feel that is truly what's made us successful here in Clay County from what we've seen is these partnerships and communication through the Unified Command. One thing I will say is our vaccines are appointment only. We are currently filled up through 20 January at this time. We do about 200 appointments a day. And as soon as we receive more vaccine in theater, which hopefully is going to be this week by midweek, we will open up additional scheduling points. For anybody that has questions or concerns, not appointments, we're not doing appointments over the phone, but anybody has any questions or anything like that, our call center is open Monday through Friday, 8 to 4:30, and that number is 877-252-9362. Again, that is 877-252-9362. So we're here at the Godbold building at the Agriculture Center in Clay County. We just opened our doors at 8:45 for our citizens that are in here, and we will be continuing this through the day. And as I stated, we're scheduled through 20 January with our appointments. As more come online, as more allocations are allotted to us, we will open up more appointments. I do also want to clarify, after our messaging that we did last night, we had some questions coming in on if this was limited to only Clay County residents. This is not limited to only Clay County residents. This is a federal funded program, so as these vaccines come in, anybody can schedule. So we're running this in Clay County, but anybody can schedule this because this is a federally funded program. Our hope is also, as we receive these small allocations, we're going to open up additional days. But what we're really watching for is as we move to the end of January into February, that a lot of our private partners come online. Our Walgreens, CVS, Walmart, Publix, those type pharmacies that'll be more dispensing points throughout the county that our citizens can go to get the vaccine and then also their second dose. So currently we are working on our first dose. By the middle of the week, we will launch our scheduling program for the second dose. And what we're going to do is we're essentially going to replicate the same scheduling we did, and we're going to push that out, and the people will come back for their second dose on that. So at this time, what I'm going to do is I'm going to go ahead and turn it over to Ms. Heather Huffman, who's the director of the health department here for Clay County. Clay County, thank you.
Thank you, John. So we're very excited to start this endeavor. We're really excited that the community is really excited about getting the vaccine, and we want to continue that excitement. But again, balance that with reality that our doses are very small at this point in quantity. And so as those doses become available, we will open more appointment slots. So just to reiterate where we're at, last Monday, the 28th, the health department received 3,000 doses of the Moderna vaccine. As you know, the Moderna vaccine is a two-part vaccination for COVID-19, separated by 28 days. At that time, we began vaccinating our paramedics at Clay County Fire Rescue along with Orange Park Fire Department and the health department staff that would be working within the vaccination pods. We are still bound by the governor's executive order of who the priority groups are. And again, those are healthcare workers with direct patient care and those 65 and older. Starting today, January the 4th, we're starting appointments only, 200 a day, which is about 1,000 a week. And then looking at our second doses that will start for the general public that are currently being vaccinated now on February the 1st. We will ramp up to 400 appointments a day. 200 of those will be for first appointments, and 200 a day will be for first doses, and 200 a day will be for second doses. We want to make sure those individuals that have gotten the first dose are able to get that second dose. Again, appointments only, so that we can make this as most efficient and create social distancing is going to be a priority. And those appointments can be made at alert.claycountygov.com. Again, limited quantities. I cannot say that enough. As we get more vaccine in each week, we will be adding appointments so that those come online and we can get those vaccinated. Again, during this time that we're doing this mass vaccination program, we want to make sure that people continue to not lower their guards. They need to continue to do those prevention messages such as social distancing, not coming within 6 feet of one person, wearing your mask, frequent hand washing, and not going to large gatherings. So again, we're going to provide those vaccines as soon as those additional doses come in. And I want to reiterate those other things that will come online here in the near future, hopefully sometime in January, which is your retail pharmacy program that the feds have entered into. A lot of your large pharmacy retail outlets, CVS, Walgreens, Walmart, Winn-Dixie, Publix, all of those will come online, and those will be another access point for them. And then lastly, there is a federal partnership program for all of our ALFs and nursing homes. CVS and Walgreens have those contracts. They are already currently vaccinating in our communities, and they hope to have first dose done by the end of January and second doses done by the end of February. So all of those residents and staff that work within those facilities will be vaccinated. So that's really good news, because those are truly most vulnerable in our community. At this time, I'll be glad to turn it over to Commissioner Sella.
Good morning and Happy New Year. My name is Mike Sella. I'm the chairman of the Clay County Commission for this year. I thank you all for your time today. I want to take just a brief moment as I get started this morning to thank John Ward and his crew and Heather Huffman and her team for their work on behalf of our residents. They have done a great job in guiding us through the past 9 months of challenges, and they have the board's complete support and confidence. And I have no doubt that as we move forward and receive more vaccines, they will get them to our residents as quickly and as efficiently as possible. You know, unprecedented times require an unprecedented effort, and we've been given that by every department and every agency in Clay County when we've asked. It has truly been a remarkable team effort, and so on behalf of myself and our board, I'd like to say thank you to all of you who have participated, and that means you residents as well. Despite the pandemic, I come to you today to remind you that Clay County is open for business. Small businesses are the heartbeat of your community, as you may know, and it's no different here in Clay County. Our locally owned shops and restaurants are mom and pop family operations where customers often become friends. And having owned and operated a small business for 9 years myself, I know how tough it is to make payroll, pay rent, and maybe have a little something left over for your own pocket at the end of the month. Never mind dealing with a COVID pandemic. So buying local has never been more important than it is now. Our local small business owners have done everything in their power to adapt to these changing times, offering curbside service, deliveries, creating new products, providing contactless payment, and many more steps. Many of our businesses have made even a bigger commitment to provide a safer environment for customers, and I've got a few examples for you here this morning. 1,000 of our local businesses have made Clay Chamber of Commerce's commitment to protect the health and safety of our customers using a grant from our CARES Act funds. The commitment includes cleaning recommendations, chemicals that the CDC recommends for cleaning, limiting group size, implementing protocol training for employees, even making sure they've got the right PPE for the premises. We also gave them a $250 grant to help with that. You can look up those businesses that have made that commitment online at supportclay.org. Many of our local hotels and residents have also earned the Florida Restaurant and Lodging Association's Seal of Commitment, the FRLA. This is a statewide program that requires training in addition to safety and cleaning standards, and more information available for them at frla.org. And our tourism department is also chipping in. They've got a safer event kit that's offered to event organizers so their events can be as safe as possible, utilizing all of the CDC COVID-19 guidance essentials. Look, we will stay Clay strong, but we do need your help. Please support our local business community. They can really use it. Remember, it's more likely that a local business is going to give a donation to a local nonprofit group, or sponsor a local youth sports team, or make accommodations for a weekly civic club meeting. And I can assure you they're all working hard to keep you safe in their facility and continue to earn your business. And while we work together to make that happen, please do, as Heather indicated, remember your physical distancing, wearing a face mask, and washing your hands often to protect yourself and others while supporting our local business community. I'd like to thank you for your time today and bring up our county manager, Howard Huffman. Howard, I just got you married off to Heather. Howard Wanamaker, by the way, who he and his BCC staff have done a great job as well. We couldn't have been as successful as we have been without his help. So thank you, Howard.
Well, good morning, ladies and gentlemen, and what a beautiful morning it is as we begin the COVID-19 vaccination distribution throughout Clay County here, and beginning with appointments, as John and Heather have mentioned. John stated earlier that, and I want to reiterate this, that our partnership with the health department and with our local area hospitals is strong. This unified command team remains committed to leading us through these unprecedented times. Their tireless efforts to set up testing sites throughout the county, and now this vaccination POD, or point of distribution or disbursement, here at the Jesse Godbold building is essential in getting the virus under control and moving beyond this pandemic. Again, I want to personally thank our first responders, our healthcare professionals who continue to work tirelessly to keep us safe during this pandemic. Please remember, we are still under a local state of emergency, and we will extend this weekly as necessary. Until most of the population has been vaccinated, we still need to practice the safety protocols established by the CDC to prevent the spread of the virus. Finally, there is light at the end of the tunnel. And the future, once again, will be bright for our county, communities, families, and businesses. We must all continue to work to do our part to protect and take care of each other. Thank you all for tuning in and attending today. Have a happy and healthy 2021. We will now open up for questions.
For those who have appointments today that are coming to the Godbold Center, are they booking the second appointment here on site, or is that something they do in the future?
Good question. Heather?
So we've been very fortunate with the partnership we've had with the BOCC. They have a phenomenal IT team, and they were able to set up and use Microsoft bookings for us. So what we're going to do is those individuals that have appointments today, they will have the exact appointment and time on 4 weeks later from today, which for these appointments today would be February the 1st. So we're going to automatically make those appointments for them.
Another question for you. Some people have been emailing us saying those 65 years and older who may not be technically savvy to go online to sign up for an appointment. What do they do? Who do they contact for help?
Again, we're going to want them to first reach out to their loved ones, their family and friends that can help them with that process. We do want to use that as the single source for booking appointments. As you know, many phone systems cannot handle hundreds of thousands of calls coming in at one time, as you've seen across the state. So we want them to reach out to people who can help them. I know if they go to the libraries, people at the library can also help them with that.
It sounds like since you have, you said you'll be at 400 in the next dose, are you able to guarantee that all the people that get their first dose here will be able to get that second dose?
So the way that the feds are handling logistics of this shipment, they are holding back the second dose for us. So they are guaranteeing us those 3,000 doses that arrived last Monday on 12/28 will arrive about 3.5 weeks later for that second dose. Then we will open up the first dose appointments based on the other additional allocation that we get.
When do you expect to get that next shipment in?
Again, the feds have said about 3.5 weeks after the first ones are shipped, so it'll be available for that fourth week.
How quickly did your appointments fill up here?
John, you have that information?
So when we initially opened, we did a soft opening on Tuesday and Wednesday for some healthcare professionals on our independent living. So the first day when we announced it at 3 o'clock on Tuesday afternoon, within 3 hours, we had 1,800 appointments booked. We then opened it up the next day for the additional days, and within about 55 minutes, the rest of the appointments were full. I'm going to defer to Ms. Huffman on that.
I have not heard that. We don't. What we are asking individuals is if they have questions about regarding if they should be getting the vaccine or not, they should be speaking with their individual primary care physician before they come and seek that vaccination with us. We're asking that to be on the patient responsibility to seek that advice from their primary care physician.
When there are new appointments that can be booked, will that be on your all's website? So should people just be refreshing this page so they can get in that 55 minutes?
Yes, absolutely, and we'll be using our social media feeds to also let the community know when those additional appointments are available.
They should stay tuned Tuesday and Wednesday tomorrow and Wednesday?
Again, as soon as we get those allocations, we're going to let John and them know. They're the one that are handling logistics for the bookings for us, and so we're very, very thankful for that partnership. And as soon as those become available, they will make an announcement. Anything else? Thank you so much. We really appreciate you getting the information out to our community.